The meeting. The emergency room pulsed with the steady hum of activity. Machines beeped, voices called orders, and the faint smell of antiseptic clung to the air. Dr. Alexander Grant moved through the ER with practiced detachment, his eyes skimming over the huddled patients without truly seeing them. Tall, impeccably dressed in his white coat, and with a well-polished name badge pinned to his chest, he was the image of a seasoned professional. He had carved out a reputation as one of the top ER doctors in the region, known for his efficiency and clinical precision. But he was also known for his aloofness, his occasional impatience with patients, and a certain air that hovered somewhere between confidence and arrogance. Dr. Grant was in his element when his gaze landed on Nurse Riley, who approached with a troubled expression. "Dr. Grant, we have a new admission in room 8. Female, early 40s, presenting with severe chest pains and difficulty breathing," she said, her voice tinged with urgency. Dr. Grant's lips tightened briefly. "And you think she needs my immediate attention because," he replied, already anticipating a case of mild anxiety or hypochondria. The nurse hesitated, clearly struggling with what to say next. "The patient was actually asking for you specifically," she added softly. He raised an eyebrow, skepticism evident. "People always want the top doctor. It doesn't mean their case is urgent," he muttered, barely concealing his annoyance. "She insists it's cardiac-related, Dr. Grant," Nurse Riley said, her tone firmer now. "She seems genuinely concerned." Dr. Grant sighed, his impatience visible as he took a quick glance toward room 8. He had no intention of wasting his time on a routine case, especially when it was likely nothing more than anxiety or perhaps indigestion. Nevertheless, he gave a curt nod. "Fine. Let's humor her." He strode toward the room with his usual confident gait, his mind already cataloging this patient as a non-critical case. As he entered, his gaze briefly met hers. She was seated on the bed, her back slightly hunched, one hand pressed to her chest, and her face was drawn in pain. She looked up at him, her deep brown eyes revealing a mix of pain and hope, and as their eyes locked, he noticed a flicker of strength and determination in her expression. This, however, only made him more convinced she was overreacting. He suppressed a sigh, adopting a detached, professional demeanor. "Ms. Riley," he greeted her, barely glancing up from the chart he held. "You seem convinced that this is an emergency. Care to tell me why?" The woman's voice was steady despite the strain of her pain. "Dr. Grant, I know my body. I've been experiencing these symptoms for over a week, and they're worsening. This isn't anxiety or acid reflux. I'm certain it's cardiac." He allowed himself a small dismissive smile, still jotting notes on his clipboard. "You're in a hospital now, Ms. Riley. If you were in genuine danger, you wouldn't be sitting up, calmly describing your symptoms to me, would you?" The woman's eyes narrowed slightly as if restraining a retort, but she remained composed. "I assure you, Dr. Grant, I wouldn't be here if it wasn't serious. I know what these symptoms indicate." Her words and unwavering tone only fueled his irritation. He couldn't help but feel as though she were challenging him, questioning his expertise. "I've seen hundreds of cases of mild chest pain, Ms. Riley, and very few turn out to be real emergencies," he replied coolly, finally glancing up to meet her gaze. "Trust me, you're not in any danger." A slight tremor of disbelief flickered across her face, but she didn't protest further. Instead, she studied him intently, her silence speaking volumes. Dr. Grant shifted uncomfortably, feeling as though her calm gaze saw right through him. Without waiting for a response, he turned to Nurse Riley. "Set her up in the waiting room and have one of the residents follow up," he said, lowering his voice just enough for the patient to hear. "This isn't a case that requires my immediate attention." Nurse Riley's face tightened with disappointment, but she gave a brief nod and moved to assist the patient. Dr. Grant observed as the woman stood, her face a mask of pain and silent endurance, though she offered no further complaint. As she walked past him, she paused briefly, her voice low but firm. "Dr. Grant, I hope that one day you learn to look past your own assumptions. Some patients know more than you give them credit for." With that, she walked away, leaving him standing in silence. A frown creased his brow, but he quickly brushed off her comment. To him, she was just another anxious patient unwilling to accept a reasonable diagnosis. But he couldn't shake the discomfort that lingered, the subtle hint that maybe he had overlooked something. As Dr. Grant returned to his rounds, he tried to push the encounter from his mind. But his thoughts were interrupted by the arrival of Dr. Peterson, the hospital director, who strode into the ER with a tense expression. "Dr. Grant," he called. Urgency in his voice. Was a Dr. Jordan Matthews admitted here today? Dr. Grant blinked, confused. "Dr. Jordan Matthews. The name doesn't ring a bell," he replied, scanning the day's patient log in his mind. "She's a renowned cardiac surgeon," Dr. Peterson said, clearly exasperated. "She was scheduled to speak here today, but I just received word that she fell ill on her way in and was brought to the ER. Realization hit Dr. Grant with the force of a freight train. His eyes widened as he connected the dots, and his gaze flicked toward the waiting area, where the patient he'd dismissed was now seated, waiting for treatment. There, seated calmly with her back straight and her hands folded in her lap, was the woman he had brushed off. Dr. Jordan Matthews, renowned cardiac surgeon, and the hospital's guest of honor. A flush of embarrassment and horror surged through him as he recalled his dismissive attitude, his careless assumptions, and his failure to take her concerns seriously. He had not only ignored a patient's distress, but had done so to a surgeon he admired, a professional who would see right through his arrogance. Dr. Grant felt his hands grow cold as he watched Dr. Peterson hurry toward Dr. Matthews with deep concern. The woman looked up, her face drawn in pain but dignified, and when she met Dr. Grant's gaze from across the room, he felt as though he were being pinned by her steady, unflinching stare. The weight of his actions sank in, leaving him feeling raw and exposed. Dr. Grant had prided himself on his clinical acumen and precision, yet he had failed to see the humanity before him. A woman in distress, worthy of respect, regardless of status. As he stood frozen, watching her interact with Dr. Peterson, he realized this mistake would not only shape the rest of his career, but would force him to confront the prejudices and pride he had carefully guarded for years. The consequences. Dr. Grant's mind raced as he watched Dr. Peterson walk toward Dr. Matthews. The realization of his mistake, a mistake fueled by prejudice and impatience, had landed heavily on him. He felt exposed, stripped of the professional armor he had built over years of practicing medicine. But he didn't have long to dwell on it. He saw Dr. Peterson's expression change from concern to something sharper as he caught sight of Dr. Grant. "Dr. Grant." Peterson's voice cut through the hum of the ER, louder than Grant was comfortable with. "A word, please. Now." Dr. Grant swallowed, a subtle burn of embarrassment settling in his chest as he turned and followed Peterson down the hall toward his office. The gazes of nurses and fellow doctors tracked him, a mix of curiosity and judgment in their eyes. Dr. Grant had often been admired for his skill, and he liked to think of himself as respected by his peers. But in that moment, he felt none of the respect he once took for granted. As they entered Dr. Peterson's office, the director closed the door firmly and gestured for Dr. Grant to sit. The silence stretched between them, amplifying Grant's discomfort. "Do you understand the gravity of what just happened?" Peterson asked, his voice calm but with an edge of controlled anger. Dr. Grant shifted uncomfortably, struggling to find his voice. I didn't know who she was. If I had known." Peterson cut him off with a raised hand. "And that's the problem, Dr. Grant. This isn't just about who Dr. Matthews is. It's about the lack of respect you showed to a patient. Any patient. Do you truly believe that someone's title or reputation should dictate the level of care they receive?" Grant's mouth opened, then closed as he realized he had no adequate answer. He could feel his own defenses crumbling as Peterson's words sank in. The truth was, He had allowed his own biases, his perception of what a patient should look or act like in crisis, to cloud his judgment. He had prided himself on efficiency and results, often overlooking the nuances of patient care, dismissing concerns that didn't align with his own rigid standards. Peterson sighed, his gaze hardening as he continued. Dr. Matthews came to us in need of immediate assistance, and not only did you fail to take her symptoms seriously, but you did so in a manner that was disrespectful and dismissive. Your words and actions have consequences, Dr. Grant. Do you understand that? Dr. Grant swallowed hard, his voice barely a whisper. Yes, Dr. Peterson, I understand. Peterson leaned back in his chair, regarding Grant with a look that was both disappointed and thoughtful. Dr. Matthews is our guest, and beyond that, she is a respected cardiac surgeon. You've put our entire team in an uncomfortable position by mishandling her case. I spoke to her just now, and she has made it clear that she does not want you to be involved in her care. Grant winced. He couldn't blame her. He had acted poorly, and now he was facing the repercussions. But there was something else beneath the shame, a realization that he didn't want to let go of his chance to make amends. I'd like the opportunity to apologize to her, he said, his voice gaining a bit of strength. If she would allow it. I know I misjudged the situation. Peterson tilted his head, studying Grant carefully. I'll pass on your request, but I can't make any promises. For now, I'll assign another physician to her case, and you will step back. As for you, he paused, folding his hands on his desk, I'm assigning you to complete an intensive series of patient communication and empathy training. You're a skilled doctor, Dr. Grant, but I'm beginning to think you've neglected the human aspect of your work. The weight of Peterson's words felt like a heavy stone in Grant's stomach. Understood, he said, though the realization stung. He had built his career around skill and competence, thinking that was enough to define him as a doctor. But now, stripped of that confidence, he felt strangely exposed, like he was only now beginning to understand the cracks in his own professionalism. Back in the ER, Dr. Grant moved through the rest of his shift with a new sense of unease. He tried to focus on the cases before him, but every interaction felt different now. He found himself observing the patients with a new level of scrutiny, as though he were seeing them for the first time. Each individual with their own story, their own worries, fears, and hopes. He could no longer ignore the subtle anxiety in the faces of those who waited in silence, or the desperation in the eyes of those who clung to his every word. For the first time, Dr. Grant noticed the tension among the nurses and residents he worked with. There was an air of discomfort around him, one that hadn't been there before. Nurse Riley, in particular, seemed distant, her usual warmth replaced with a reserved professionalism that left him feeling oddly isolated. At the end of his shift, he approached her at the nurse's station, hesitating before speaking. Riley, he began, forcing himself to meet her gaze, I wanted to thank you for bringing Dr. Matthews' case to my attention. I didn't handle it well, and I regret how things went. Nurse Riley's expression softened slightly, though there was still a guarded look in her eyes. Dr. Grant, she replied carefully, I appreciate your words, but it's not just about one case. This isn't the first time you've dismissed a patient's concerns. It's just, this time, the stakes were higher, and the consequences were more visible. Her words cut deeper than he'd expected. Dr. Grant had always considered himself dedicated and efficient, but he was beginning to see how those very traits had sometimes distanced him from the people he was supposed to be helping. As he left the hospital that evening, he felt an unfamiliar weight settle on his shoulders. It wasn't the exhaustion of a long shift, nor was it the typical stress of high-stakes work. It was a realization, one that filled him with a complex mix of regret and determination. The following week, Dr. Grant's daily schedule was restructured. Alongside his regular shifts, he was now required to attend empathy training sessions, a requirement he had initially resisted but now saw as essential. His first session was with a behavioral psychologist, Dr. Elena Morris, who specialized in helping medical professionals improve their patient communication skills. Dr. Morris was a small, soft-spoken woman with a gentle demeanor that immediately put Dr. Grant on edge. She was the complete opposite of the authoritative figures he was used to, and he felt a pang of discomfort at the thought of being instructed by someone so seemingly meek. Yet, as the session progressed, he realized that her approach was anything but soft. "Dr. Grant," she began, her voice calm but firm, "I understand you've been assigned to empathy training due to a recent incident. Can you tell me, in your own words, what happened?" He shifted uncomfortably, his gaze falling to the floor. "I misjudged a patient," he admitted. "I thought she was exaggerating her symptoms, and I didn't take her concerns seriously. It turns out she was a respected surgeon, Dr. Jordan Matthews, and I failed to see that she needed immediate care." Dr. Morris nodded, her expression thoughtful. "And why do you think you dismissed her concerns so quickly?" Dr. Grant hesitated, his pride warring with his desire to answer honestly. I suppose I saw her as another anxious patient, someone who wasn't in real danger. I assumed she was overreacting." Dr. Morris leaned forward, her gaze unflinching. "And what about her appearance or behavior led you to that assumption?" He felt his cheeks flush with embarrassment. "I didn't see her as someone in genuine distress," he confessed. "Maybe I let my biases cloud my judgment. I assumed she was fine because, well, she didn't fit the image of someone in serious cardiac distress." Dr. Morris nodded, her expression gentle yet probing. "Dr. Grant, one of the challenges in our field is recognizing and overcoming our own biases. Patients don't always fit the textbook images we have in our minds. They come from all backgrounds, all walks of life, and their experiences may look very different from what we're trained to expect." He absorbed her words, feeling the weight of his own assumptions settle heavily on his shoulders. The session continued, with Dr. Morris guiding him through exercises to increase his self-awareness and empathy. She encouraged him to look beyond the surface of each patient interaction, to see the person behind the symptoms, and to question his own assumptions rather than relying solely on instinct. By the end of the session, Dr. Grant felt both exhausted and strangely relieved. It was as though a weight he hadn't known he was carrying had been lifted, leaving room for something new, something that felt a lot like hope. As he left Dr. Morris's office, Dr. Grant found himself replaying the conversation in his mind. He still had a long way to go, but for the first time, he felt a genuine desire to change. He knew it wouldn't be easy, and that he would face resistance, both from others and from within himself, but he was ready to take the first step. Just as he was heading toward the elevator, he saw Dr. Matthews in the corridor, her steady gaze meeting his. She nodded once, a small gesture, but one that felt like an acknowledgement. Dr. Grant returned the nod, feeling the surge of gratitude and determination. He would earn her respect, and the respect of his colleagues, not through titles or authority, but through the humility and humanity he was beginning to rediscover. Humility and lessons. Dr. Grant arrived early for his shift the following day, feeling a blend of anticipation and trepidation. Though he had been practicing medicine for years, this new approach, one that forced him to look beyond the clinical aspects of his work, left him feeling like an intern again. As he walked through the hospital corridors, he could feel the curious and cautious stares of his colleagues. Word had spread quickly about his misstep with Dr. Matthews, and he knew it would take time before his reputation recovered. The first case of the day involved a middle-aged woman experiencing chest pains. Dr. Grant recognized the woman's nervousness immediately, her hands trembling slightly as she explained her symptoms. Normally, he might have written it off as another case of stress, but his recent training and the impact of Dr. Matthews' case were fresh in his mind. This time, he forced himself to slow down, to ask questions rather than make assumptions. "Tell me more about how you're feeling," he said, taking the seat at eye level with her. "When did the pain start?" The woman blinked in surprise, as if unused to such genuine interest from a doctor. "It started a few days ago," she replied, her voice hesitant. "At first, I thought it was indigestion, but it hasn't gone away. I was worried it might be something serious. As she spoke, he noticed subtle signs, a slight pallor, shallow breathing, and a look of relief when he didn't dismiss her concerns. Dr. Grant realized how often he had overlooked these signs in the past, chalking them up to anxiety rather than genuine distress. This time, he ordered a more thorough examination, taking her concerns seriously and assuring her they would investigate all possible causes. The woman's anxiety visibly eased, and she offered a faint smile. "Thank you, doctor," she whispered. "I was worried you'd think I was overreacting." Dr. Grant managed a small smile in return, his own relief mingling with a sense of purpose he hadn't felt in a long time. "It's my job to listen," he replied simply, though the words felt new on his tongue. As he left the examination room, he found Nurse Riley watching him from the doorway, her expression unreadable. She approached him cautiously, but with a hint of approval in her gaze. "That was different," she remarked, her tone neutral but tinged with curiosity. He nodded, feeling both humbled and encouraged by her words. "It's about time I started listening to the patients, isn't it?" he admitted, forcing himself to meet her gaze. Nurse Riley gave him a small nod, her expression softening. "It's a good start," she said quietly, before turning back to her duties. Dr. Grant felt a small surge of pride, earned not from accolades or skill, but from a quiet acknowledgement of change. That afternoon, Dr. Grant attended his second empathy training session with Dr. Morris. Today's topic was empathy through perspective, an exercise designed to help doctors see their patients not just as cases, but as people with complex lives and experiences. He entered the room with a mixture of skepticism and discomfort, unsure of how much more vulnerable he was willing to be. Dr. Morris greeted him warmly, motioning for him to take a seat. "Good to see you again, Dr. Grant. Today's session will involve a bit of reflection. Are you ready for that?" He nodded, though his jaw was tight. "Yes, I'm here to learn," he replied, trying to sound more confident than he felt. She handed him a case study, an account of a patient who had faced multiple misdiagnoses due to biases and assumptions by various doctors. As he read through the case, he felt a familiar pang of guilt. The patient's story mirrored the same attitude he had often held, an outlook shaped by years of clinical detachment and personal pride. After a few moments, Dr. Morris broke the silence. "How does this case make you feel?" He hesitated, unsure how to articulate his growing unease. "It reminds me of the ways I've failed to listen to my own patients," he admitted. "I was so focused on proving myself and maintaining control that I dismissed their experiences." Dr. Morris nodded, her expression empathetic. Doctors often face pressures to meet time demands, to perform at high standards. It's easy to become detached, to shield ourselves from the emotional impact of each case. But empathy doesn't weaken us, Dr. Grant. It strengthens our connection with patients, allows us to serve them more effectively. He absorbed her words, feeling the truth of them settle within him. For years, he had told himself that keeping a distance made him a better doctor, that objectivity was essential to excellence. But now, he could see how that very detachment had dulled his ability to truly understand his patients. Dr. Morris continued, her voice gentle yet unwavering. "Next time you're with a patient, I want you to ask yourself, what is this person afraid of? How can I reassure them?" These questions may seem simple, but they have the power to shift the dynamic of care. Dr. Grant left the session feeling both humbled and inspired, a subtle but significant shift in his perspective. Later that day, Dr. Grant saw Dr. Matthews in the hallway near the cardiac unit. She was leaning against the wall, speaking to a young resident with a relaxed but attentive demeanor. She looked up, meeting his gaze, and paused. For a moment, he felt his old insecurities bubble to the surface, but he steadied himself and approached her. "Dr. Matthews," he began, keeping his voice steady, "may I have a moment of your time?" She looked at him thoughtfully, then nodded, gesturing for the resident to go ahead. "Of course, Dr. Grant." They stepped aside, finding a quiet corner away from the main hallway. He took a deep breath. feeling the weight of what he wanted to say. "I owe you an apology, Dr. Matthews," he said, his voice earnest. "I didn't see you as a patient. I saw you through my own biases, and I'm deeply sorry for how I handled things. I'm working to change that." Her gaze softened, but there was a measured distance in her expression. "Thank you, Dr. Grant. I appreciate the apology," she replied, though her tone was guarded. "But changing your approach isn't something that happens overnight." "I know," he admitted, feeling a pang of regret. "But I want you to know that I'm taking the steps to improve. I don't expect forgiveness, but I do want to earn back the respect I lost." She regarded him quietly, as if weighing his words. After a moment, she nodded slowly. "Actions speak louder than words, Dr. Grant," she said. "If you're serious about changing, that will show in your work, not just with me but with every patient you see." Her words were gentle yet firm, and he knew they came from a place of experience. Dr. Matthews was not someone who would be swayed by apologies alone. He felt both chastened and motivated, determined to live up to the challenge she had set for him. "Thank you, Dr. Matthews," he said softly. "I won't forget this." She nodded once more, her gaze steady, before turning and walking away, leaving him to reflect on their conversation. Over the next few weeks, Dr. Grant threw himself into his empathy training and took the lessons to heart in his daily practice. With each patient interaction, he found himself pausing, asking more questions, and striving to understand their fears and concerns. It was not an easy transition. Old habits tugged at him constantly, reminding him of the comfort of detachment. But he was determined to change, to prove to himself, and perhaps to Dr. Matthews, that he could become a better, more compassionate doctor. One morning, he was assigned to a young man who had come in with severe abdominal pain. The man was clearly distressed, his voice shaking as he tried to explain his symptoms. Dr. Grant recognized the signs of someone who had been in pain for some time and felt unheard. Taking a deep breath, Dr. Grant seated himself beside the patient, meeting his eyes. "Tell me everything," he said, his voice steady. "No detail is too small." The man looked surprised, then relieved, as he recounted his symptoms in detail. Dr. Grant listened attentively, allowing the man to finish before asking clarifying questions and ordering the necessary tests. After they finished, the patient offered a hesitant smile. "Thank you, doctor. It feels like I'm finally being heard." The words struck Dr. Grant with an unexpected impact. He realized then how much he had overlooked in his previous approach. The subtle signs of relief, the hope in the eyes of those who felt genuinely cared for. It was a quiet but powerful lesson, and one that stayed with him long after the patient had left. As the days passed, the whispers in the hospital began to change. Nurses, residents, and even Dr. Peterson noticed the subtle shift in Dr. Grant's demeanor. He was no longer the aloof, authoritative doctor they had come to expect. Instead, he was listening, engaging, and showing a level of empathy that surprised many. One evening, Nurse Riley approached him with a faint smile. "I can tell you've changed, Dr. Grant," she said. "It's refreshing to see." Her words filled him with a quiet sense of accomplishment, not for his skill or reputation, but for the simple acknowledgement that his efforts were making a difference. By the end of the month, Dr. Grant knew he had a long journey ahead, but he also felt a renewed sense of purpose. He was no longer driven by pride or the need for recognition. Instead, he was motivated by something deeper, a commitment to his patients and a determination to grow, not just as a doctor, but as a person. A test of compassion. Over the next few weeks, Dr. Grant settled into his new routine. Each patient encounter became a subtle but powerful reminder of his ongoing transformation. His empathy training with Dr. Morris had opened doors within him that he hadn't realized were closed, and he found himself reevaluating each aspect of his practice. Instead of merely addressing symptoms, he was now focused on understanding the patients behind them. He took extra time during consultations, encouraged questions, and offered reassurance. The reactions from his patients and colleagues began to shift. Some, like Nurse Riley, welcomed the change with cautious optimism. Others remained wary, as though unsure if this new Dr. Grant was truly here to stay. The transition wasn't easy. Some days he felt the temptation to revert to his old, efficient methods. But the memory of Dr. Matthews' unwavering gaze, combined with Dr. Peterson's reprimand, kept him grounded. One afternoon, as Dr. Grant was reviewing patient charts in his office, a nurse knocked on his door, her face lined with concern. "Dr. Grant, we have a critical situation in the ER. It's a trauma case, a car accident. The patient's vitals are unstable, and they've requested the head of surgery for immediate consultation," she explained, urgency clear in her voice. Dr. Grant stood, the old adrenaline of a crisis sparking in his veins. Trauma cases had always been his strength, a place where he could let his skills take over without being burdened by emotions. But today, as he prepared to step into the chaos of the ER, he felt a renewed sense of responsibility to approach this case differently. He would not let this be a return to his detached style. As he entered the ER, he saw the patient, a young woman, barely 20, with severe injuries from the crash. She was conscious but in obvious pain, her face pale, as the team worked to stabilize her. Dr. Grant moved to her side, introducing himself gently. "Hi, I'm Dr. Grant. You're in good hands here," he said, keeping his voice steady and warm. "Can you tell me how you're feeling?" The woman looked up at him, her eyes glassy but focused, her voice a faint whisper. I don't want to die," she murmured, fear evident in her voice. Dr. Grant felt a pang in his chest, a powerful reminder of the vulnerability that had so often gone unaddressed in the cases he had handled in the past. He reached for her hand, giving it a reassuring squeeze. "You're going to be okay. We're doing everything we can to help you," he assured her. "Right now, I need you to take a few slow breaths for me. Focus on your breathing, okay?" She nodded, following his instructions, and he watched as her panic subsided slightly, replaced by a faint sense of calm. The team moved quickly, administering fluids, managing her pain, and preparing her for surgery. Throughout the process, Dr. Grant remained by her side, giving steady updates and making sure she understood each step. It was a small gesture, but he could see the relief in her eyes. As she was wheeled toward surgery, she reached for his hand one last time. "Thank you, doctor," she whispered, a faint smile touching her lips. "Thank you for being here." Dr. Grant felt a surge of unexpected emotion, a powerful reminder of the impact compassion could have on someone in distress. This was different from the usual rush of satisfaction he'd felt in past crises. This was something deeper, a reminder of the trust and vulnerability his patients placed in him. He knew then that this was the kind of doctor he wanted to be, not just skilled, but someone his patients could rely on for empathy as well as expertise. After the surgery, Dr. Grant returned to his office, feeling a complex mix of exhaustion and gratitude. He leaned back in his chair, reflecting on the day's events. It struck him that in all his years of practicing medicine, he had never felt this level of connection with a patient. It wasn't just about saving lives anymore. It was about making patients feel seen, valued, and supported. His reflections were interrupted by a knock on his door. He looked up to see Dr. Matthews standing in the doorway, her expression unreadable. "Dr. Matthews." He greeted her, standing up. "It's good to see you." She nodded, stepping inside and closing the door behind her. "I heard about the case you handled today," she said, her voice calm. "Nurse Riley mentioned that you took a different approach than usual." Dr. Grant felt a surge of pride mixed with a touch of apprehension. He knew that Dr. Matthews had been keeping a close eye on him, observing his progress since their confrontation. "I've been trying to incorporate what I've learned in training," he replied. "Today's case, it felt different. I realized that patients aren't just numbers or cases. They're people, and they need us to be present, to care." A faint smile tugged at the corner of Dr. Matthews' mouth. "That's good to hear, Dr. Grant. It seems like you're beginning to understand the importance of empathy in our work." Her approval felt like a validation he hadn't known he needed, but he didn't allow himself to become complacent. "I still have a lot to learn," he admitted, feeling the weight of his ongoing journey. "But I'm committed to this. I want to be the kind of doctor my patients can trust." Dr. Matthews nodded, her gaze softening. "That's a start," she replied. "Empathy and trust aren't things you learn overnight. It's a continuous process, one that requires humility and patience. I hope you'll remember that even on the days when it feels challenging." He felt a surge of gratitude for her words. For all her reserved demeanor, Dr. Matthews had proven herself to be an invaluable mentor, guiding him toward a deeper understanding of his role as a doctor. "Thank you, Dr. Matthews," he said sincerely. "I appreciate everything you've done to help me get here." She offered him a brief nod, then turned to leave, pausing at the door. "Remember, Dr. Grant, it's not just about being a skilled doctor. It's about being a compassionate one, too. Keep that in mind." With that, she left, her quiet presence lingering in the room long after she had gone. Dr. Grant felt a newfound determination solidify within him. This transformation wasn't just about redeeming himself in the eyes of his colleagues or earning back Dr. Matthews' respect. It was about redefining his own understanding of what it meant to be a healer. Over the following days, Dr. Grant found himself navigating an uncharted balance between skill and compassion. Each patient interaction felt like a test of his resolve, a reminder of the standards he had set for himself. He began to notice the small moments that often went unacknowledged. The look of relief in a patient's eyes when he listened attentively. The gratitude from family members when he took the time to explain a procedure in simple terms. But not all encounters were as rewarding. Some patients remained wary of him, and he could sense their skepticism. Dr. Grant knew that his past reputation as a detached doctor would take time to overcome, and that there were those who would always see him through the lens of his former behavior. One evening, as he reviewed his schedule for the next day, he noticed a familiar name, James Holloway. He remembered Holloway from a previous consultation, a gruff older man who had dismissed Dr. Grant's diagnosis and demanded a second opinion. It had been a difficult encounter, one where Dr. Grant's impatience had flared, leading to a tense exchange. He braced himself for what was sure to be another challenging interaction, reminding himself to approach it with patience and empathy. When he entered the examination room the following morning, Holloway looked up, his expression wary. Dr. Grant could sense the tension in the room, a reminder of their last encounter. "Mr. Holloway," he greeted, keeping his voice calm. "It's good to see you again. I understand you've been experiencing some discomfort recently. Can you tell me more about it?" Holloway hesitated, his expression skeptical, but he began to explain his symptoms. Dr. Grant listened carefully, nodding along and asking questions to clarify his understanding. This time, he resisted the urge to jump to conclusions, instead allowing Holloway to describe his experience in full. As the conversation progressed, Holloway's demeanor softened, and he seemed to grow more comfortable. Dr. Grant offered explanations for each symptom, taking the time to address the older man's concerns rather than dismissing them. By the end of the consultation, Holloway looked at him with something approaching respect. "I appreciate you taking the time, Doc," he said gruffly, his voice softer than before. "Last time, I wasn't sure about you, but today was different." Dr. Grant felt a quiet sense of accomplishment, the kind that came not from accolades or recognition, but from knowing he had made a difference. "Thank you, Mr. Holloway. I'm here to help," he replied simply, feeling the weight of his commitment settle even deeper within him. As the days turned into weeks, Dr. Grant's transformation continued, each patient interaction a reminder of the journey he had undertaken. The trust he was slowly building with his colleagues and patients brought a sense of fulfillment he hadn't expected. He realized that compassion wasn't just an added benefit to his practice, it was the very foundation of it. One evening, as he prepared to leave the hospital, he received an email notification. It was from Dr. Matthews, a brief message that contained a single line. "I see your progress. Keep going." The message was simple, but it held a depth of meaning that struck him profoundly. Dr. Matthews, the person who had become his unexpected guide and mentor, had recognized his efforts. It was an acknowledgement he hadn't known he needed, but it filled him with a sense of purpose and renewed resolve. As he walked through the quiet corridors of the hospital that night, Dr. Grant knew that his journey was far from over. He would continue to face challenges, to confront the lingering remnants of his past behavior, but he was ready for it. For the first time, he felt not just like a doctor, but like a healer, committed to serving his patients with empathy and integrity. And with each step he took, he felt a quiet but unshakable certainty that he was exactly where he was meant to be. A deeper challenge. The weeks following his email exchange with Dr. Matthews were some of the most transformative in Dr. Grant's career. He found himself approaching each day with renewed dedication, an understanding of the quiet power of humility and the responsibility of his position. For all the progress he had made, however, he knew there was still much ground to cover. One evening, as Dr. Grant prepared to end his shift, Nurse Riley approached him with a hurried expression. "Dr. Grant, we have a complex case in room 7. A middle-aged man with severe liver disease. He's been on a transplant list, but his condition took a turn tonight. He's critical." Dr. Grant's face tightened in concern as he nodded, moving quickly toward room 7. When he entered, he found the patient, Mr. Julian Porter, in visible pain, his breathing labored as he clutched at his side. Mr. Porter's family stood by his bedside, their faces etched with worry. "Dr. Grant," Porter's wife whispered, her voice thick with emotion. "They told us you are one of the best. Please, please help him." Dr. Grant felt the weight of her words, her trust in his abilities. He met her gaze and nodded gently. "I'll do everything I can, Mrs. Porter," he assured her, moving to her husband's side. He introduced himself, keeping his voice calm as he began assessing Mr. Porter's vitals and medical history. Mr. Porter's voice was faint but determined as he spoke. "Doc, I know things are looking bad," he said between breaths. "I've been through a lot, and I'm not afraid of the truth. Just give it to me straight." Dr. Grant met his gaze, feeling the raw honesty and resilience in Mr. Porter's words. He knew from the files that Porter had been on the transplant list for over a year, battling his illness with courage. "Mr. Porter," he began gently, "your condition has taken a serious turn, and we're monitoring everything closely. I'll be here to guide you through each step, and we'll do everything possible to support you." The family listened intently as Dr. Grant explained the treatment plan, pausing to answer each question they had. He could see the relief in their faces as he took the time to address their fears, ensuring they felt informed and empowered. After stabilizing Mr. Porter's pain and setting up the necessary treatments, Dr. Grant left the room, only to encounter Dr. Simon Chambers, one of the senior physicians in the department, in the hallway. Chambers was known for his clinical brilliance, but he also had a reputation for dismissing soft aspects of care. He had noticed the recent changes in Dr. Grant's behavior and had been less than supportive. "Dr. Grant," Chambers called out, his tone laced with skepticism, "I see you're still working on your empathy experiment." Dr. Grant's jaw tightened, but he forced himself to remain calm. "I'm just doing what's best for the patients, Dr. Chambers," he replied evenly. Chambers raised an eyebrow, folding his arms across his chest. "I have to say, it's surprising to see you spending so much time hand-holding. It's hardly the most efficient use of your skills." Dr. Grant resisted the urge to respond defensively, reminding himself that old habits would die hard in some of his colleagues as well. "Patients need more than just technical skill, Dr. Chambers," he said, his voice steady. "They need reassurance, someone who will listen. They're not just cases, they're people. I've come to realize that this connection is essential." Chambers scoffed, shaking his head. "I'm sure that feels rewarding in the short term, but I've seen plenty of doctors burn out trying to be heroes, getting too close to the patients. You should be careful. Empathy can be a double-edged sword. Dr. Grant held his gaze, feeling a strange clarity settle over him. Maybe it is, he replied quietly, but I'd rather risk burnout than become the kind of doctor who forgets the humanity of the people we're here to help. Chambers gave him a long, scrutinizing look, as though weighing his words, then turned away with a dismissive shrug. "Suit yourself," he muttered, walking down the hallway without another word. As Dr. Grant watched him go, he felt a flicker of pride. For the first time, he wasn't swayed by the opinions of others. He was focused on the kind of doctor he wanted to be, someone who valued his patients as people, not just cases. Over the next few days, Dr. Grant continued to check in on Mr. Porter, developing a rapport with both him and his family. They looked to him for updates, clinging to his words as he explained the progression of Mr. Porter's treatment and prospects. But despite their optimism, he couldn't ignore the signs of Mr. Porter's decline. The man's condition was deteriorating faster than expected, and Dr. Grant knew that without a transplant, his time was running out. Late one night, as he sat in his office reviewing Porter's file, Dr. Grant felt the weight of the situation bearing down on him. He thought back to Dr. Chambers' words about the emotional toll that came with getting too close to patients. But instead of feeling regret, he felt a renewed commitment. These people, the Porters, had come to rely on him, to see him as more than just their doctor, but as an ally in the battle for Mr. Porter's life, and he wasn't willing to let them down. The next morning, Dr. Grant met with the transplant committee, advocating for Mr. Porter's case. He presented every detail, arguing that Porter's condition warranted immediate priority on the transplant list. The committee members listened, but Dr. Grant could sense their hesitation. He knew that there were many others in critical condition, all with equally compelling cases. He couldn't change that reality, but he could continue fighting for his patient with every resource he had. Returning to the hospital later that evening, Dr. Grant entered Mr. Porter's room to find the man's family gathered around him. They looked up, hope and fear mingling in their expressions. He approached Mr. Porter, who met his gaze with weary eyes, but a faint smile. "Doc," Mr. Porter said quietly, his voice laced with exhaustion, "I've heard you've been fighting for me, pushing for that transplant. I appreciate that. But I need you to promise me something." Dr. Grant leaned in, listening closely. "Of course, Mr. Porter. What is it?" Porter took a slow, deep breath, as though gathering his thoughts. "If it doesn't work out, if I don't get that liver, promise me you'll help my family understand. Help them let go. I don't want them to feel like they have to keep hoping if there's nothing left to hope for." The request hit Dr. Grant harder than he expected, a reminder of the delicate balance between hope and acceptance. He took Mr. Porter's hand, nodding solemnly. "I promise," he replied, his voice steady, "but I'm not giving up on you. And neither is the team. We'll keep fighting as long as there's a chance." Porter's grip tightened briefly, gratitude filling his tired eyes. "That's all I can ask for, Doc. Thank you." Dr. Grant stayed with the family for a few moments longer, offering words of comfort and reassurance. It struck him how far he had come in the past months. From the detached doctor he once was to someone who now found strength in these connections, even as they tested his own resilience. 3 days later, in a surprising twist of fate, a liver became available. Dr. Grant was informed late in the night, and he moved quickly to inform the Porter family. They met him in the hallway, their eyes wide with hope, and he could see the relief in their faces as he delivered the news. The surgery was scheduled immediately, and Dr. Grant watched as Mr. Porter was prepped and taken to the operating room. He paced outside the OR, the weight of the family's hope resting heavily on his shoulders. Hours later, the surgical team emerged, the lead surgeon nodding with a faint smile. The transplant had gone smoothly. When Mr. Porter woke up in recovery, his eyes met Dr. Grant's, a look of profound gratitude crossing his face. "You kept your promise, Doc," he murmured, his voice barely above a whisper. "Thank you for fighting for me." Dr. Grant felt a surge of emotion, the kind that reminded him why he had become a doctor in the first place. "Thank you, Mr. Porter," he replied, "for letting me be part of this journey." In the days following the transplant, Mr. Porter's condition improved, and Dr. Grant found himself drawn to visit the family regularly, sharing updates and celebrating each milestone in Mr. Porter's recovery. For them, he was no longer just a doctor but a trusted ally and friend. Their gratitude was humbling, and it filled him with a sense of purpose that no title or accolade ever could. A few days later, he crossed paths with Dr. Chambers in the hallway. Chambers offered him a curt nod, but couldn't conceal the look of surprise in his eyes as he observed Dr. Grant's newfound camaraderie with his patients. Dr. Grant met his gaze with quiet confidence. "Empathy isn't a weakness, Dr. Chambers," he said simply. "It's what makes us human, and it's what our patients need most." Chambers looked away, his face unreadable, and walked down the hall without a word. But Dr. Grant knew that his actions had spoken louder than any argument could. As he sat in his office that evening, Dr. Grant felt a deep sense of peace. He was no longer the detached doctor he had once been, shielded by pride and arrogance. Instead, he was a healer, someone who understood that compassion and skill went hand in hand. A notification on his phone caught his attention. A message from Dr. Matthews. He opened it, reading her words. "I see you've come a long way, Dr. Grant. Keep going. Proud of you." The message brought a smile to his face. Dr. Matthews' guidance had changed his life, and he was forever grateful. But more than that, he was proud of himself, for taking the hard path, for embracing change, and for becoming the doctor he had always aspired to be. As he left the hospital that night, Dr. Grant knew that his journey was far from over. He would continue to face challenges, to question his approach, and to grow. But he was ready for it, anchored by the conviction that he was on the right path, a path guided by empathy, integrity, and an unwavering commitment to his patients. The legacy of compassion. Months passed, and the changes in Dr. Grant became evident not only to his colleagues and patients, but also to himself. He felt lighter, as though he had shed a weight he hadn't known he was carrying. The pride he once held in his skill alone had evolved into a quieter, deeper satisfaction. Each day, he walked through the hospital with a sense of purpose, knowing he was making a difference in a way that went beyond diagnosis and procedures. His impact had started to ripple through the hospital, fostering a culture of empathy and respect that resonated with both staff and patients. Dr. Matthews' influence was still there, guiding him like a steady compass. Though she had returned to her own hospital, they exchanged messages now and then. She remained a mentor, providing insight and encouragement, reminding him of the journey that had brought him here. One morning, as Dr. Grant entered the hospital, he noticed a new poster on the wall, a quote from Maya Angelou that read, "People will forget what you said, people will forget what you did, but people will never forget how you made them feel." The words resonated deeply with him, reflecting the very transformation he had undergone. Dr. Grant paused, taking a moment to let the message sink in, then continued toward his office, more resolved than ever. Later that day, he was assigned to a case involving a young girl named Emily, who had been admitted with a severe respiratory condition. Emily was just 10 years old, with bright, inquisitive eyes that belied her weakened state. As Dr. Grant entered her room, he noticed her mother, a woman in her 30s, sitting at her bedside, visibly exhausted but maintaining a brave face for her daughter. "Hello, Emily," Dr. Grant greeted the girl warmly, pulling up a chair beside her bed. "I'm Dr. Grant. How are you feeling?" Emily looked up at him, her voice soft but steady. "I don't like hospitals, Dr. Grant. They're too quiet. And it smells weird," she said, scrunching her nose in a way that made him chuckle. He nodded, keeping his tone light. "I completely understand. But I'm here to help make sure you get to go home soon, so you won't have to put up with the hospital smells for much longer." Emily's mother managed a faint smile, her eyes filled with a mixture of hope and worry. Dr. Grant turned his attention to her, offering a reassuring nod. "Mrs. Whitmore, I'll walk you through the treatment plan. and we'll make sure Emily gets the best care possible. If you have any questions, I'm here for both of you." Over the next few days, Dr. Grant visited Emily frequently, making sure she and her mother were informed and comfortable. He spent time explaining each step of her treatment, answering every question they had. He even took a few minutes each day to chat with Emily about her favorite hobbies, listening as she told him stories about her friends, her dog Max, and her love of painting. One afternoon, as Dr. Grant checked in on her, Emily handed him a small handmade card. It was a simple piece of white paper folded into a card shape, with a stick figure drawing of Dr. Grant, Emily, and her mother on the front. "Thank you for being nice to my mom and me," Emily said shyly. "You're the best doctor I've met." The words struck him in a way he hadn't anticipated. For all the accolades and recognition he had once pursued, nothing felt as meaningful as that small card, a gesture from a young girl who saw him not just as a doctor, but as someone who cared. "Thank you, Emily," he replied, touched. "This is the best card I've ever received. I'll keep it right in my office." As he left her room, Dr. Grant felt a profound sense of gratitude. This was what he had been missing all those years: the connection, the trust, the opportunity to truly make a difference in someone's life. The experiences with Emily, Mr. Porter, and other patients had redefined his purpose, reminding him that the heart of medicine was as much about healing souls as it was about healing bodies. In the weeks that followed, Dr. Grant's approach began to influence his colleagues. Nurse Riley, who had initially been skeptical, now often worked alongside him, sharing in his dedication to patient-centered care. Together, they made a powerful team, supporting each other in creating an environment that prioritized compassion as much as competence. The younger residents and interns started noticing the difference in Dr. Grant as well. He had become someone they looked up to, not for his technical skill alone, but for his ability to connect with patients, to make them feel seen and valued. His presence in the hospital became a steadying force, a reminder that empathy could coexist with excellence. One day, as he led a group of interns on their rounds, Dr. Grant paused before entering a patient's room. "Before we go in," he said, addressing the group, "I want each of you to think about something. When we're with patients, it's not just about diagnosing and treating. It's about listening, understanding, and connecting. Patients may forget our faces, but they'll remember how we treated them." One of the interns, a young woman named Sarah, raised her hand. "Dr. Grant, I've noticed that you spend a lot of time talking to patients, even when it's a busy day. Doesn't that slow you down?" Dr. Grant smiled, understanding her question well. "It may take a little more time, but it makes a big difference. When patients trust us, they're more open, and that trust can lead to better outcomes. And believe me, the time we spend building that trust is never wasted." The interns listened intently, nodding as they took in his words. For many of them, this was a new perspective, one that challenged the fast-paced, efficiency-focused approach they had been taught. But Dr. Grant could see the spark of understanding in their eyes, the realization that medicine was more than just procedures and diagnosis. A few weeks later, the hospital organized a staff meeting to discuss updates to patient care protocols, and Dr. Grant was invited to present his insights. Standing before his colleagues, he felt a mixture of pride and humility. He knew he was addressing people who had once seen him as detached and aloof, and he wanted to share his journey with them in a way that was honest and open. "Over the past months," he began, "I've had the privilege of learning something that I once overlooked. As doctors, we're trained to focus on efficiency, to prioritize results. But in the process, I lost sight of the very reason I became a doctor in the first place: to help people, to connect, to care." He paused, glancing around the room, seeing familiar faces, some nodding in understanding. "Our patients come to us in their most vulnerable moments. They need more than just our skills. They need our empathy. They need to know we're listening, that we're with them, that we respect them. I've come to realize that the best doctors are those who balance skill with compassion." When he finished, there was a silence that hung in the room. heavy with understanding. Then, one by one, his colleagues began to applaud, their faces filled with respect and appreciation. It wasn't the applause he had once sought, the kind that came with awards or accolades, but it felt more meaningful, a recognition of the quiet yet powerful transformation he had undergone. In the months that followed, Dr. Grant's approach became a model within the hospital. New protocols were established, inspired by his insights on patient-centered care. Staff training included empathy modules, workshops on effective patient communication, and sessions designed to help doctors and nurses reconnect with the human side of their profession. One day, Dr. Matthews visited the hospital to speak at a conference, and Dr. Grant had the opportunity to meet with her afterward. They sat in the hospital's quiet atrium, catching up on their respective journeys. "You've come a long way, Dr. Grant," Dr. Matthews said, a faint smile playing on her lips. "I can see it in the way people here talk about you. You've become someone they look up to, not just as a doctor, but as a leader." Dr. Grant felt a warmth spread through him, her words filling him with a sense of pride and gratitude. "I owe a lot of it to you," he replied sincerely. "You pushed me to see beyond my own biases, to recognize that medicine isn't just about skill, but about connection." Dr. Matthews nodded thoughtfully. "You did the hard work, Dr. Grant. You chose to change, and that choice has made all the difference." They sat in companionable silence, each lost in their own thoughts, both understanding the power of transformation and the humility it required. As Dr. Matthews prepared to leave, Dr. Grant shook her hand, his grip firm but respectful. "Thank you, Dr. Matthews, for everything." She nodded, her gaze warm. "Keep going, Dr. Grant. You have a chance to make a lasting difference, not just for your patients but for everyone who works with you. That's the real legacy of a healer." In the years that followed, Dr. Grant continued to uphold the principles he had learned, building a legacy that went beyond medical skill. His influence spread throughout the hospital, shaping a new generation of doctors who understood that healing was about more than just treatment. It was about empathy, humility, and respect. His office walls were lined not with certificates or awards, but with small notes, cards, and drawings from patients who had felt his kindness, each one a reminder of the journey he had taken. Emily's card still held a special place, a simple drawing that represented everything he had come to value. And so, Dr. Benjamin Grant became known not just as an exceptional doctor, but as a compassionate healer, someone who had learned to balance knowledge with kindness, skill with empathy. His legacy was a quiet one, but it resonated deeply, touching the lives of those he treated and those who worked alongside him. For he had discovered the true heart of medicine, not in the accolades or the prestige, but in the simple, profound act of caring.